A 75 years old lady is investigated for episodes of painless hematuria. Apart from COPD, from long-term smoking, she is otherwise well. She has no other urinary symptoms. What is the most likely cause? So 75 years old lady, that means old age, investigated for episodes of painless hematuria. Apart from COPD and long-term smoking. So these 3 points, one of them is the older age, second one painless hematuria, and third one is long-term smoking. So they are the suggestive of the carcinoma, and the older age, actually these are predisposed for development of the carcinoma. So what may be the options? Options are transitional cell carcinoma, squamous cell carcinoma, adenocarcinoma, and these 3 carcinoma of the bladder, stone disease, arteriovenous malformation of the bladder. So first of all, let's see the bladder cancer. The bladder cancer is the second most common urological cancer. That means in the urological system, the bladder cancer is the second common, and it usually occurs between the 50 to 80 years of the age. That means in the older age. So any cancer, especially almost all the cancer, usually occurs in the older age. And in case of smokers, it increases 2 to 5 fold. And exposure of the hydrocarbons such as the beta-naphthalamine also increase the risk. And also there is an infection which is by Schistosoma hematobium, which is a parasite, and when this Schistosoma hematobium infection occurs, in this condition squamous cell carcinoma develop in the urinary bladder. Now see the different type of the tumor. They are the benign tumor and malignant tumor. In benign tumor, they are papilloma and adenoma. They inverted urothelial papilloma and nephrogenic adenoma. So papilloma and adenoma, they are the benign tumor of the bladder. On the other hand, the other malignancies of the urinary bladder, we know normally the lining epithelium of the bladder is the transitional cell, and so the cancer developed from transitional cell, it is known as transitional cell carcinoma, and it accounts for about 90% or more than 90%, and it is related to the smoking. So in case of smoking urinary bladder, there is chance of development of transitional cell carcinoma. There is the another one which is the squamous cell carcinoma. Squamous cell carcinoma occurs by which organism, or irritation, chronic irritation by which organism? It is by the schistosomiasis. There may be adenocarcinoma, but which is very smaller amount, which is about 2%. So let's see the transitional cell carcinoma of the urinary bladder. It is the most common tumor of the urinary bladder, and it is strongly related to the smoking. So smoking is strongly related to the development of transitional cell carcinoma. Renal adenocarcinoma may produce similar symptom but less likely. It is very less, which is 2%. So now what is our answer? First of all, it is older age. Second one, there is painless hematuria, and third one, there is long time history of the smoking. These 3 conditions suggest that it is the transitional cell carcinoma. And here we can see the squamous cell carcinoma. It occurs due to Schistosoma hematobium infection, and here the adenocarcinoma, which is very less, about 2%, and stone disease. In stone disease, the hematuria usually very painful, and when there is arteriovenous malformation of the bladder occurs, so what happened? There is no bleeding. Actually, in arteriovenous malformation, blood flow occurs. Blood flow occurs through the abnormal blood vessel, but there is no bleeding. So our answer is the transitional cell